Okay, this is Dr. P here, and I just got a bunch of texts regarding Mike Trout, who re-tore the meniscus in his knee. Now, people are asking me, is he going to be out? It says he's going to be out for the rest of the season, unfortunately. So what happened? Well, basically, the meniscus is the shock absorber cartilage in between the bones. This is a model knee. You have a thigh bone, you have a shin bone, femur, tibia, you have the kneecap, the patella, you have the outer leg bone, the fibula. And there's two types of cartilage in the knee. There's the cartilage on the end of the bone, which looks kind of like the white on the end of a chicken bone, if you've ever seen that before, that smooth white cartilage. That's called the articular cartilage. That's like the tread on a tire. When that wears down, that's what arthritis is. However, there's also the meniscus cartilage, which is these little semicircular shock absorber cartilages in between the bones. They are a shock absorber, they protect the cartilage on the end of the bone, and they also provide stability to the knee, because you can see this tibia bone is flat and this femur bone is round. So having that meniscus gives stability to the knee, and it gives shock absorbing capability to protect the articular cartilage, the tread. Now, the reason when the meniscus tears it doesn't heal is it doesn't have a very good blood supply. Just along the very outer edge does it have a good blood supply, so sometimes we can get some stitches in the outer edge of it and get it to heal. Other times we can inject things like PRP or bone marrow cells, stem cells, things like that in there to try to get that to heal or enhance a repair that we do. Here's an MRI, and this is a patient that I literally just took care of. And this patient, this is the thigh bone, here's the shin bone, and the meniscus is this little black triangle in between. So if you zoom in, you can see it's a nice little black triangle. The meniscus should look completely black, no bright white lines through it, whereas the outer meniscus, so this is the inner side, the medial meniscus, the lateral meniscus on the outer side on this person has a big bright white line going right through it. That's a meniscus tear. Now, this person did not want surgery, no matter what. So what I did was I injected some bone marrow cells that has stem cells and other cells that help the stem cells, and I injected some PRP into this area using ultrasound, and our goal is to get that to heal. Even with a repair, 8 or 9 times out of 10 it's going to heal, but 1 or 2 out of 10 times it's not going to heal. So we're hopeful that using biologic procedures will help, but the meniscus is a tough thing, and unfortunately, as Mike Trout found out, you can do surgery on it, you can do all the right things, and sometimes it either doesn't heal or it re-tears again, and unfortunately, that's what happened to him, so now he's going to be out for the rest of the season.